So now I will be discussing a personal case with you, and the pointers that I will share in this video, these pointers are going to be useful whenever you find yourself in a situation like this. And everything that I'm going to share here is only based on one personal learning. Now, I was a part of this family for so long that I was almost co-coaching a senior citizen who had a severe case of Alzeimer's. In smaller phases, it is called memory loss, and she was already showing a lot of signs of memory loss in the earlier stages. And when it becomes very aggressive, it was medically declared as Alzheimer's disease case. Now here the person cannot recognize you, they cannot hear you properly, they also have speech issues, and because it's a memory problem, they don't remember when they say something, so they are going to be repeating something over and over again. Now they will also have cognitive problems, and it will affect their vision as well. Now vision problems can happen with anybody, especially if you are staring at your screen for so long and for many years, but vision problem is also common with age, and this issue happened with her as well. Now there are a lot of collateral damages that come, especially when it is about the brain. There are many things we don't understand. We just have to be prepared for collateral damages. Now question 1, can somebody with an Alzheimer's case go to the gym, or can they actually work out? The short answer is yes, but just hear me out. So we used to take her for early morning gym session. Now this was at 6:30 a.m. and even though her memory loss back then was not too bad, she could perform some workouts very well. Now she would do machine-based workouts like leg press, seated rows, dumbbell bicep curls, assisted shoulder press, but her range of motion was somewhat semi to half, and for seated rows it was almost a full range of motion. Now if they are taking rest between sets, they have to sit, so we had a walker for her on days when she would walk outside, but in the middle of the rest sessions she had to sit. She had a weaker musculoskeletal structure. She also had a slightly bent back. We always tell people that whenever you are young, you have all your limbs like working properly, you work out so that whenever you're growing a little older, these problems are not too aggressive. If you have to gain strength, if you have to build muscles and endurance, do it now when you are younger. Also, by the time we are older, there is a lot of wear and tear in our body, in our bones and joints. So just to prevent that by a small margin, we have to be active now. Now many people think that just because somebody is a senior citizen or they're older, they must be weak. She was not weak at all. So when she was younger, she was very strong. Now when she was of my age, she was actually very strong. So at this point, she was using her strength. Okay, now remember I said she did not remember a lot of things. She did not remember who I was. So whenever I would help her, she would resist so much. She was so strong. Now imagine I am somebody who works out, and when I would go to help her, she would resist so much. So it was like on most occasions difficult for me to help her. Now this is where you do not use your force. Even if you have strength, don't use it. They have brittle bones, and if you pull something, they might break their bones or they might pull their muscle, and just avoid these disasters. This is where you use a technique to lift them up. So I had to use some techniques to lift her off the bed, make her sit down. Now this reminds me that I have a powerlifting friend who is a national champion. So he said that when somebody is into the powerlifting sport, they use a lot of technique. It is not just the weight, but a lot of technique. You can lift a lot of weight. So more than strength, you also have technique, and this is a concept that you can use even with people, especially when it is it gets difficult to lift them off. And if you're doing something like this, you cannot lose your temper, you cannot be angry, you have to be very patient. And when I say patient, it's not just a small amount of patience, you have to have a lot of patience. Number 2, what was she eating on a daily basis? We cut off all refined and sweet food treats strictly, not allowed. They have no nutritional value. She did not also have a dental set, so we had to give her a mix and mash of vegetables. So we would cook the vegetables, let it cool down and make a mash out of it. So that mash would contain all the nutrients and all the fiber in itself. On top of that, we also gave her high quality whey and casein supplements as well. Now whey and casein supplements are not just for somebody who is a baby or a bodybuilder, it is also for senior citizens. Now especially when somebody is not getting those nutrients nutrients out of food, then you have to rely on supplements. If you see a lot of people who are older or senior citizens, they don't share the same enthusiasm to eat a curry, chicken curry or egg curry. You can ask your own grandparents. They also might suffer from some digestive issue. So what nutrients that they will not get from food, you have to rely on supplements. See, nutrition is for everybody. You have to give them the essential aminos and nutrients. So that's when these only authentic well-branded supplements are going to be very useful. We would also keep her adequately hydrated and give her food on time. Now, if you don't have a food timings, just don't do this injustice with senior citizens with this condition. Give them their food and water on time. Number 3, what were her activities on a daily basis? We kept it very simple but very fun. She liked to listen to music. Now, I said that she did not have a good hearing capacity. So whenever we would play a music, we would play it little louder. So she would have the vibrations from the music, a little sound, and she would like to dance. So we would kind of make her dance. This is when she would also smile. On top of that, we gave her simple mathematics like 2 plus 2 subtraction, some puzzles were there, some coloring books were there. Now these activities were just to keep her brain neurons firing and just to delay the issue for a little longer. You have to keep them mentally and physically active. The brain is a complicated organ, so you have to do things in the real world just to avoid the aggressive nature of the disease. Now, brain is a master organ. So she also did not have bladder control. This is where you invest in good adult diapers. So make sure that the material is soft or probably cotton. It should not cause rash, itchiness or redness. Our private parts have very sensitive skin. So whenever you are giving them some material, make sure that it does not come in contact with a sensitive skin and cause problems in those areas. Also check their back daily. So they might also sweat a lot because they're sitting there for a long time. Whenever it is summer or it is not possible for you to lift them up all the time, you can dab their body with some wet cloth and then wipe it up with another dry cloth. See, they can also take a bath, okay, but then you have to manually go and give them that bath. And after you dry their skin, especially the back area, so if a doctor suggests a good antifungal powder, do put that as well. Make sure that the skin is not wet, sweaty, same thing, it should not have rashes, should not be itchy. Now, if they are at home 24/7, which they are going to be at home, so something like a loose garment night dress is also very good, something like a cotton. Now, these protocols are not just for somebody who is a female, it could be a grandfather as well. The protocols are similar, but just the way that you handle the person will depend on case-to-case basis. Now, you have to give them their medicines and vitamin supplements exactly on time according to doctor's prescription. Now, here is something I'll tell you. When you go offline and you're actually handling somebody like that in offline in the real world, you give them the supplement and you cannot assume that they are going to eat it, okay? First of all, she did not have dental set, and whenever we would give her a tablet, obviously she would throw it. For her, this tablet is a foreign object. This is when you have to manually check, okay? You give them the supplement and give them the drink as well so that they can gulp that supplement with the liquid formula. And you have to check their mouth whether they have taken it, because what she used to do is she would keep the supplement on her tongue, find out ways to throw it out. So this is not going to help her condition. So you have to manually check whether the person has actually consumed that supplement or that medicine. Number 4, the worst case scenarios to avoid. Now, when somebody has a very severe medical condition, there are basically 2 outcomes. One is they are going to be perfectly fine. Number 2 is they are going to succumb to it. So if you are mentally prepared for these things, maybe the intensity of the outcome, you can manage it at certain points. It's not fair to say that, but however, if we're looking at it objectively, well, we have to train ourselves for situations like this. Now, whenever you're putting them to sleep every night, of course, they have to wear loose-fitting clothes, they have to be comfortable. So check that they can sleep in a position or posture which is comfortable. And during cold seasons, you have to make sure that you cover their ear, nose and throat. They can be very vulnerable, or they may catch cold, they may get the cough. So make sure that you close the ears, the nose and throat, especially if they're going outside. It's going to be very windy. So them getting cough and cold is another health hazard. Like Cold is literally a health hazard for them. Whenever they are going outside, stepping outside, you can also invest in some anti-slip shoes. Now, a lot of sports shoes, they are not really anti-slip, but if you check those sports shoes during rainy seasons, they have the tendency to slip. Okay, so if you're investing a little more money, buy them anti-slip sports shoes. Or you can also invest in Crocs. See, Crocs are also good because it's kind of stable and there is a little bit of ventilation when they're wearing them. It's easy to put on and take it out. You cannot leave them unattended at any point of time because one, their bones are so brittle, they really do not have that balance, and if they fall, they're going to break bones, and there is another health hazard on top of that. So you want to avoid as many collateral damages in your own house. Now consider this: whenever you are calling for maids and caretakers, remember something: caretakers are rough handlers. I will tell you why. First of all, maids and caretakers, they do not have that knowledge to handle a severe medical case. They don't have the patience. They are going to use brute force, which is what we want to avoid, and they do not care about your family member. Even if you're giving a maid or caretaker just for a short time, you still micromanage them and check up what they're doing. Like I said, you cannot lose patience if you are handling a medical case, that too you are with them 24/7. You cannot lose your temper. You have to be very gentle because they have different needs, and this is something that only a family member can understand another family member. Remember that they were also very young once upon a time. They had dreams, ambition. They did everything to give you something, and in return, if you can care for them, nothing like it. Now, the brain is a very complex organ. Like I said before, we don't know everything. So what you can do at best is read some research papers, talk to other doctors, researchers, maybe nationally, internationally, talk to other coaches who have handled the case before, find out how you can help them offline, utilize every thing that you have studied. Always ask for help. Sometimes the case can get bad to worse, and you don't want to be helpless whenever you are in that situation. If you have gone through similar cases like this, please share it in the comments below, because I will read and get more information, and my viewers who are watching this video can also get additional information from you. I hope this video was helpful, and I will see you in the next video.